Hello, my name is Sam Greenburg and I'm a senior at LHS. This interview was part of Project Wisdom, a program out of LHS that works to take the wisdom of Lexington seniors on current issues such as climate change and politics and sort of make that into a set of interviews that will help to inspire and teach younger generations. In this interview, I was with my neighbor, Eileen Sussman, on a Zoom call, and we had a great time. So without further ado, let's get into the interview. My name is Sam Greenburg, and I want to thank you for agreeing to have this conversation with me. Before we start, I need to confirm that you give consent to being recorded.
Yes.
Great. Let me begin with a brief summary of our project. It's called Project Wisdom, and it's an initiative to interview as many seniors as possible so that we can draw from their experiences to create a roadmap for bettering society in the present and the future. After all, those who cannot remember the past are condemned to repeat it. So, first of all, tell us about yourself. Where did you grow up? How did you get to where you are today? Essentially, what is your life story?
Oh, you should have a box of tissues. It's I grew up in New York City in Manhattan, and how strong are you? I'm hesitant to tell my life
Okay,
story.
we don't want any filters. We want to learn from your life story.
Okay, my there was 6 years difference between my brother and me. I was the younger one, and unfortunately, when I was 4 and he was 10, he was in a fatal vehicular accident. He was run over by a bus. It was Erev Pesach, and my parents had let him go out on his roller skates. These are on New York City streets. And
Yep.
the story that's been passed on to me was he slipped off the curb onto the street and was run over by a bus. And that was the demise of my family. There was my parents, of course, and the whole family were devastated, and there weren't mental health resources out there at the time. Maybe there were for a privileged few, but I don't know. My parents did have yet another child, my sister, and I may be going back and forth a little bit. This is
No
going to
worries.
take a
Take your
while.
time.
I have a sister 8 years younger than me, but I don't know if she's alive or not. She she was adopted. Oh, I'm rushing ahead. My father was, my parents really needed mental health counseling, and my father wound up in a mental hospital for 10 years and then stepped out and was discharged, and my mother's best friend proposed to him. My mother committed suicide. See why I said you need a
Yeah.
box of tissues. My mother committed suicide. My father went to a mental hospital, and there I was. And my mother's sister took me in along with my sister, but they were living in a 1-bedroom apartment, and they were already 4 people. They had 2 children. So I went to summer camp, and when I came home, my sister was no longer living there because a relative, distant cousins who had no children, said she would take my sister while my aunt's children were recovering from chickenpox. But my aunt said she knew Roberta was not going to return to her. And Roberta went on to be adopted. It was by immigrants and very German, and I think it was a very authoritarian home. And I remained with my aunt until I was 11, and then I was sleeping in the middle of the living room, so it was thought best when I went to high school that I should go and live with my grandmother, which I did. And where I stayed until I was 16 years old. And I thought it best that I graduate high school early and go on to school. And I just had mapped out my whole life and then be able to be self-sufficient. So I applied to nursing school, and I was told 16 was a little too young, but I think I twisted their arm and they admitted me. And my high school wasn't too happy that I was graduating early, but I had met all the course requirements and did that. And then they called me back when they were doing a state scholarship exam. I guess they knew I could use the money. And I was already in nursing school and did get a state scholarship, which I never really had to use because after nursing school, I went on to Hunter College in New York, which is now the City University of New York, and it was free. I was very fortunate. So I kept in touch with my sister, but at the time of Haight-Ashbury, and she was 16, she decided she was going to go to California, and she managed to get a ride there and changed her name to Flower, and her adopted name was Reichelsheimer, so she became Flower Reichelsheimer. My maiden name being Rosenstock. And eventually her adopted mother hired a detective and looked for her, but there was really no reconciliation. But and there was a guy who this relative had also taken under wing, but never lived with them, never officially adopted Freddie. And Freddie was the child of a Holocaust situation. So they were brought up together, and Roberta had a relationship with them. And when she came east, she was very close to them. I saw her occasionally, but all of a sudden she just cut off from them as well as from us. So to this day, I don't know if she was dead or alive. And I guess I was just talking to a friend who has a daughter she doesn't hear from, and we decided after the holidays, we both were going to get on the computers and do a search and support one another. So I think I was very fortunate in meeting Alan, and he had a wonderful, very giving family. My father was released from the mental hospital after 10 years, and Alan's father, who had a candy slash stationery store in Washington Heights across from the high school, gave my father a job, which I really thought was very, I don't know, gracious, and I'm filled with gratitude that he did that, and they were very nice to us. And as most of my friends did, we married very young. I was 20 and Alan was 21, but we had our master plans we were still in college for getting our degrees, and waited, I don't know, about 5 years, and then we had a daughter and later on a son. Am I leaving anything out? I worked as a public health nurse in New York City. I was just telling my daughter this, how I would, besides working in the schools, I worked in a BD clinic and a TB clinic, and also would go up and down stairs in tenement buildings, and they had no elevator because they were only 5 stories high. And I would have my little blue public health nurse bag, and I would give immunizations. And we were contrasting that to today, where no one's going into the home to give flu shots. And yet children now, I don't know if you know this, children in public school are mandated by Charlie Baker to have flu shots by December, or they're put out of school.
Yeah.
So my daughter works at the Italian Home, which is a school for children that were in extremely disorganized homes, and children are mostly in foster homes. And I'm trying to convince her to possibly change jobs because I think she's in a very vulnerable position for COVID.
Yeah.
Anyway, we texted back and forth for about an hour this morning, where I was told never to bring up career change again. So, especially since she's 57 years old, I think that she doesn't need telling her what to do. What else? Oh, I told you I went to Hunter College and worked as a public health nurse. And then when we moved up here, I worked for, I also did hospital nursing, and I worked, it was interesting to me when I heard you say that you were interested in neuro, because I elected to work on the neurology ward when I first graduated. And not only was it one floor of neurology patients, it was a second floor of neurosurge patients. And I constantly had to run up and down between wards O and P to check on them. And then I worked as a school nurse because I felt the hours would be best for the family. And I also worked in nursing homes when they were very young, and I could do that on weekends because I did it because I wanted to. It wasn't for the money. I have a regret about that. I think I should have been home. So what else can I tell you? Now I'm very active in my chapter, Buckman, of Lexington at Home, a group of seniors who have chosen to age in their own homes. Am I talking too fast?
No.
Group of seniors who have aged in their own homes. And now we are beginning to have younger people being in their 70s, and we have people in their late 80s and 90s in the group. And the idea of the group is to be able to help one another out. And I'm the help in a pinch person. And if somebody says they have to get to the doctor, I have a list of people that volunteered or that used to volunteer to do that. And and in COVID days, that's impossible anyway. But there are people in their 80s don't want to drive in the dark and don't want to drive beyond the touching towns.
Right.
So really not working as far as resources are concerned. But we have been very creative And we are Zooming together right and left. It seems to me every time I turn around, there's a Zoom meeting. We meet as a whole group once a month. I'm on the steering committee, so that's once a month. But every week we have either a short story discussion on Zoom, and we all bought a short story book from which the stories are selected.
Yep.
And some are online. And we also have a movie group. And since most people only have Netflix, the movies have to be available on Netflix. And we do that. And, you know, people, especially people living alone, really depend upon that.
Right.
But people living alone, I can see they're very feel socially deprived and wanting. And I have a little group that I social distance with, but we find that we can only do it with 4 people because if we sit further apart, a lot of people are hearing impaired.
Yeah.
We can't hear.
Right.
And we haven't been able to get another group of 4 off the ground to social distance. I don't know why, if we haven't asked the right people, or some people seem to be reluctant to share chairs. We did it that way once, and the homeowner felt she had to wipe the chairs down afterwards. This was outside, so we bring our own chairs, but some people, also there could be a parking problem. Where I go, we social distance in the driveway, and so there's not a long walk because a lot of people have mobility problems.
Right.
So it's very difficult for seniors now.
Yeah.
And the Lexington Senior Center has been fruitful with a lot of programs, Zooming and giving out a curbside, a drive-by lunch,
Yep.
so on and so forth. The thing I'm worried about is the older population getting their flu shots.
Yeah, that's tough.
It's really problematic. They don't want to go to doctor's offices. I just got mine 2 days ago at Walgreens, and I called and they said there's no wait. And I went in and got it right away, and there were mark-offs on the ground on the floor for social distancing. So I'm trying to convince people to go there. They don't make appointments. They're
Right.
also talking about a shortage. If I'm going too long on one subject,
No, it's okay.
they're talking about,
We move on whenever you're ready.
right, they're talking about a shortage of flu vaccine, and the Lexington Board of Health has scheduled a clinic, but they haven't said if it's going to be drive-by. I think it will have to be. And whether they'll have the high test, I don't know. And I had contacted them years ago.
Yep.
About a flu clinic for seniors, and they're not entitled to enough flu vaccine because availability, what's available for them is limited. And I don't know if that changed at all this year, but I'm worried about people. Well, with Walgreens, there's parking nearby. That's good. All right, I can go on to another subject.
All right. Throughout your life, you have likely seen many changes in the world. What we want to know is how has the American lifestyle or just the general human experience transformed over your lifetime, and do you see these changes as good or bad?
Well, I now I have on my looking at myself living in Lexington. I just see these changes as, I don't know, being wonderful. Having being after living in New York City, being in a town that seems so caring and does have services, and I'm on the Lexington list. And do you know what the Lexington listers are? Well,
Nope.
it was started by somebody called Harry, named Harry Fosdick. I think 35 years ago, who lives on Burlington Street. And there are different categories. There's a computer group, there's a, you know, general group. I don't know what the other groups are. And people talk about anything and everything, but in a very friendly way. They don't just discuss politics, but they talk about anything from flu vaccine to, I don't know, downsizing, or sometimes very esoteric topics. And I tend to look at it too much and too long before I go to bed. And I don't have special glasses
Yeah.
for. So what am I saying? That I, for me, you know, the fact that someplace in the world that can happen, and people, it's composed of people of quite a variety of different ethnicities, and it's just beautiful to see. Let's see, change in health. I just now with telehealth, I'm having telehealth physical therapy, believe it or not. And I thought, you know, at first, well, she's going to do it once and just do an intake, but it's working out very well. When I told the PT this week that I was having trouble pulling out the drawers in my refrigerator and really getting a backache, she said, well, show me the refrigerator. And I
Right.
thought, oh, this is something I couldn't have done if I went in for it. So there are advantages and of course disadvantages to telehealth.
Yeah.
I think um, I'm doing it more from looking at it from today's standpoint. I'm very pleased that Black Lives Matter is being thought about and acted upon, and
Mrs.
that's
Sussman, your camera's a little low. I'm getting a half portrait of your face. There we go.
okay. I have it.
Sorry about that.
Okay, I usually sit in the dining room, but on the table, but I didn't do that. Is that all right?
Yeah, it was fine. It was just I was only
Yeah.
getting nose and mouth.
Okay. Um, so I have a sign. Incidentally, maybe you could somehow show me in the backyard how to put it up. I can't get I can't get the frame to go in between the corrugated board.
Okay. Message me and we can work on that.
Okay. Um, what else?
We can
Uh,
move on to the next question
oh, all
if you'd
right.
like. Um, so what would you like to see in terms of the government's relationship with the people in general?
Oh,
I know, deep questions.
right. Um, which government, the state or the national?
Up to you. You can do both if you'd like.
Uh-huh. Well, I really would like to see a government. I would like to see somebody who is president, like Biden, who who had feelings and knew how to relate to people, and didn't have prejudices, and didn't have their own bank account, so to speak, involved.
This is just becoming a slight roast of our current president in the background, isn't it?
Yes, it is. It's not what is that now?
Oh, that's perfectly allowed. I just have to be unbiased, which is going to be difficult for me, but no worries.
Okay, well, that's your challenge. I'm sure you're up to it.
Yeah.
I would like to see, I don't know about socialized medicine. I mean, I've heard that it's not all it's cracked up to be, that sometimes people have to wait 8 months for surgery.
Oh yeah, we have a discussion of healthcare later down. It's one of the
Oh,
topics
okay.
later down.
All
Uh,
right.
if you want, we can move on to another topic, and we'll get to healthcare. It's the second topic after climate change. If you're happy to
Okay,
move on.
sure.
Um, so in the news, especially this year, climate change reform is a hot topic, and scientists have said that if we do nothing now, we basically have about 10 years, give or take, before the Earth is inhabitable for humanity. With the ways countries and international organizations are functioning right now, do you truly believe climate change can be stopped before it's too late?
Well, they say I heard something about having 3 years that we could make changes and it would not be too late.
Yeah.
Uh,
Oop.
we have to have the funding, of course,
Right.
and we have to have a person in charge who can,
Utilize the funding.
yes, utilize the funding and feel passionate about the subject.
Right.
And we do contribute to is it the EDF?
Yeah. Um, so I'm gonna take it. You view it as it's a possibility, but it's unlikely given the current state of governments.
Right.
Right. Um, so with the belief that it's
Let's,
what?
I'm concerned about the next generation.
Yeah. Well, that actually relates to the question is with the belief that it's unlikely that climate change reform is going to happen. What do you have to say to the younger generations who may not be able to live as long as you have, if you have anything to say at all about that?
I have chills. I mean, I hadn't quite, I knew life wouldn't be the same for them, but you're right. I, well, I guess my grandchildren seem to be following their passion. And I would say, do it.
All right. Well,
My granddaughter is a dancer, and at the beginning of COVID, she's a graduate of Smith.
yeah.
She figured out how electronically, that's the right word, people could continue practicing and teaching dance. And she developed a program called Free School, and it's taken off nationally. And universities who have dance schools are using her model.
Cool.
And my grandson, who was never a team member for sports, when COVID came and some people, about seniors, had not completed their gym didn't have enough gym credits, he was able to map out a program for them to do at home on their own and get their gym credits.
Yep.
And his passion is working with people and showing them how to strengthen and make a strong body. He's working in the Y part-time now.
Cool.
And he better get a flu shot soon or else.
So basically, live life to the fullest, even if climate change results in health problems that may or may not shorten life expectancy.
Right.
Yeah.
To get some satisfaction out of life.
Watch Ferris Bueller. All right. You may have seen young activists such as the famous Greta Thunberg, along with students at LHS, leading walkouts and grassroots movements. Do you believe that this passionate activism can produce real policy and real changes, and why?
Well, I do. When you had a walkout, this is for the environment last year.
Yeah, we had at least one.
I was there. I wasn't allowed to say I was a member of Lexington at home because we can't get involved politically, but we had 3 or 4 other seniors present.
Yep.
And I think that's important.
And you think it can produce real policy and real changes?
Well, Rabbi Jaffe once said you have to have hope.
Yep.
I try to work on that, having hope.
Okay, so for healthcare, what is your stance on healthcare in the United States?
All right. I think that there are a lot of people that are not covered, that don't have opportunities for healthcare, and we have Massachusetts is different, but there are many people that are in need of healthcare.
Yeah. On healthcare, what do you think works and what doesn't? It can be from an ideological point of view or just specific programs in general, that what works and what doesn't.
I think it starts with health education in the schools. I think that's very important. What works?
Okay, we can move on if you want.
Education. And
Yep.
public health nurses making home visits like I did. Whoops.
Oop. Well, we can move on to the next question. Many people are saying that costs are spiraling out of control, such as the cost of insulin, which has led people to have to ration their supply. What do you think should be done about that?
Calling our congressman and facilitating change. At Temple Isaiah, there's a group, a social action group that worked very hard on this.
Go. Many people are saying that the costs are spiraling out of control, such as the cost of insulin, which has led people to having to ration their supply. What do you think should be done about that?
I think that the government is going to have to cover the difference. We'll have more people getting sick, staying out of work, losing their job,
Yep.
children dropping out of school, and that will cost us in the long run.
So you're saying that increase the financial support of healthcare from the government so we don't face economic loss from resulting deaths and leaving school and just stuff that healthcare would have naturally would have covered if it's there. Those issues will cause more loss than the money that the government would pay to support those people now before any issues happen.
Right. And prevent further health problems.
Yeah. What was healthcare like in terms of your own experience before the 2000s? In comparison to that time, what is different about healthcare today?
Well, hospital stays are much shorter, very much shorter. My husband was recently hospitalized, and he stayed during COVID times. He was stayed overnight, and all the follow-up tests were left to be done on an outpatient basis. And the hospitalization must have been over a month ago, and he has yet one appointment scheduled in October.
Yep.
That is connected with the hospitalization.
All right. Do you want to move on to criminal justice?
I don't know. Is there anything further? I repeat the question again.
The last question was, what was healthcare like in terms of your own experience before the 2000s, and in comparison to that time, what is different about healthcare today?
That doctors have a much more limited time that they can spend with patients.
Mm-hmm.
And of course, it's more expensive. We happen to be very lucky. I have health care from Waltham schools, and I don't even have a copay. But for many people, a copay holds them back from going to the doctor.
Yeah. All right, well, why don't we move on to criminal justice, which I say in a lovely tone for a not so lovely subject. The first question is, are the riots in Minneapolis and in other parts of the United States, such as Atlanta, reminiscent of the Rodney King riots in LA during the 1992?
I have to be honest, I really don't know because I
Okay,
didn't go so carefully then.
no worries. Then we can move on. I will just cut that out. A much broader question, or well, actually, I'll cut this entire thing out. I'll just ask it without the whole prompt. The person who wrote this added a bunch of over dramaticism prompts. You'll see in the very last questions, there are a few last questions, they're so dramatic. In the war on drugs and during the 80s, there was a very hard crime stance in the government. However, with new legislation such as the First Step Act being passed and organizations such as the Innocent Project being formed, criminal justice is taking a step to become more based around rehabilitation than incarceration. What is your general view of criminal justice in America right now, especially in the context of current riots and marches in America during this time?
Well, I think that there's prejudice there.
And your opinion on rehabilitation or incarceration in the criminal system?
Hmm. I'm all for rehabilitation. How much education goes on in the incarceration system, I don't know. I used to have a friend who went in to prisons to teach.
Yeah.
But I think without that going on, well, that incarceration really doesn't facilitate change, but it, I guess, in a sense, can protect the public. So it's not, I don't know, either or exactly.
Yeah. All right. So there are a few more questions, three more unrelated questions, which you can choose to answer or not, just at the very end. The first being, how do we erase the stigma around aging? And do you find that there is a stigma or not?
Hmm. I think there is a stigma. Um, and it's something that people at least in my Lexington at Home group are very aware of, and a lot of discussion about it. And they feel there's a stigma in Lexington, which I don't know. I don't feel. I know maybe I'm oblivious to it. That's it.
Okay. Wow, this is.
Well, maybe one second, maybe job-wise, well, she's not a senior. My daughter felt that she had applied for a job recently, and she felt she did not get it because of age.
And what do you think can be done about that? Anything?
Well, I guess it would be people. I don't know.
It's not an easy question to answer, really.
Right.
All right, well, we'll move on to this next question.
Educate the public.
Educate the public. Yeah, well, sometimes that's the best answer. Usually it's the best answer. Sorry, I'm really struggling with this question. What dangers do you think that society should be warned about? I know, it's very, very vague.
Oh, that's the whole question?
That is the whole question.
Well, I think environment, I mean, that's something they could do something about.
Yeah.
What other dangers should they be warned about? The Trumpian dangers.
Do you want to be more specific? Maybe not using Trump so much as an example, but the way he acts instead, so I can remain unbiased.
For example, for children, especially, the fact of his comments about people in the military and
Yeah.
putting them down, very, very bad.
Oh yeah. All right. Oh boy, it's the cliche-filled last question. As a young man, what advice would you give to me and my peers as I grow up in an ever-changing world? Any opportunities to latch onto, any words of wisdom? That is, after all, the goal of our project. I'm sorry, I can't read it without laughing. It's such a great, it's like the ending to one of my like 7th grade writing assignments, you know? You should read my paragraph because it defines the world. I enjoy it though. This is my second interview. I interviewed Mrs. Nas the other day, and
Really,
I had the exact same reaction to this question. I just can't keep a straight face. Ever changing world. I'm sorry.
what advice would I give you? To hang in there, to be on the right track, to continue being the person I can see that you are now. When you mentioned that you sing, that put another dimension to who you are, to have aspirations and to work towards fulfilling them. Like I really was very excited when you said you were interested in neuro.
Yeah.
And to do that and to I think that I think Judaism is a wonderful path to follow.
All right. Is there anything else you would like to discuss as someone who's passing on wisdom to us in general? Any other questions you want to make for yourself and then answer?
To keep in touch, to keep in close touch with your family, with your parents. What else? And to take good care of yourself, but both your body and your mind and your soul. That's a large order.
Yeah.
But the three go together.
Yeah. All right. Well, if that's everything you want to talk about, I appreciate you coming and volunteering to be recorded for this. I will send it to Project Wisdom, and they will, after I edit it, and they will probably edit it further, and then some days somebody will probably watch it, and I hope that they get something from it and helps them improve their life and be a better person. So thank you for spending the time. And
I know I'll think of other things when we're on. I won't stop. Can I add one thing?
Of course.
And I can hear that you know this already. To realize that life can be wonderful without all the things that you now have available to you in Lexington.
Yeah.
It can be a good life anyway.
All right. Yeah. Amen. Yeah. High holidays are coming up soon, aren't
Yeah,
they?
they are.
Did you hear the temple is doing, oh, I'll stop the recording.